Dr. Potts, are those the only people not present?
Lori Halsey and Dr. Wingert and Dr. Nelson.
Okay, so we're kind of shy tonight then.
Mm-hmm. Who's joining us right now? Is that Dr. Muehlman?
Lori Halsey just joined.
Oh, see, I need to learn your guys' phone numbers by heart.
Sorry, I can't get it to work. I've been trying for about 10 minutes.
You're fine.
Is that the Microsoft Teams?
Yes.
Yeah, I haven't been able to get it to work either.
Well, we're happy you guys were able to join us just the same.
Yeah, that works out.
Dr. Ruckman,
Yes.
Would you like to start the meeting?
Yes, let's just go ahead and get started, and then anybody who comes a little bit late, that'll be all right. Let's go ahead and take a quick look at the meeting minutes from the last meeting, and anybody that would like to move the acceptance and approval of minutes, do so when you get a chance.
I move to approve the minute.
There you go, and I'll
Okay.
second Jason's.
All in favor, say aye.
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 Any opposed? It passes. Okay. Well, let's go ahead and take a look here. Our third point of interest is the Public Health and Recreation Grounds Property Tax Levy. So Christina, what can you inform us about that particular issue?
Yes, well, I know I had shared a draft PowerPoint with you guys this last week. We have continued looking at it, and staff made some changes tonight. So I want to let you guys know you're not seeing things, you're not misremembering things. It is slightly different than what we thought it would be. We decided to take a step back and reassess from the very beginning where we want our health department going. What services do we want to offer? And, you know, how do we want to do this? Are you guys seeing my PowerPoint screen?
Yes.
Good. Okay. So I will go ahead and start us out. So currently, well, back up a little bit. As you guys all know, you were wonderful and supported us in going ahead and getting our local public health recognition this last year. Part of that was the state agreed to provide us funding to restart our public health department, but that funding would not start until the next cycle, which starts for some of them this summer. We, of course, need public health more than ever during this pandemic. And so we have been looking for ways to start hiring people. One of the ways that we're currently funding it is what we call the Recreation Health Levy. It brings in approximately $2.6 million a year. 32% of that $2.6 million goes to animal services, which of course you guys know that I also wear that hat, and 68% funds parks, recreation, tourism. So that 32% works out to roughly $832,000. It funds 9 staff members, including all of our animal services officers and multiple members of management, including myself. It also funds operating expenses for the shelter. So everything from, the gauze we need in the vet clinic to the, washer or dryer we need at the shelter. Additional funding that we're looking to receive is from the state. They're pass-through funds primarily. They're estimated to bring in this next year about $300,000. Those big ones are FEP CRI, which that's Public Health Emergency Preparedness, and the city's Readiness Initiative. MCH, which is Maternal Child Health, and CORE, which is essentially it's supposed to be there to fund the core purposes of public health. So what our initial proposal is, because we're in the midst of budget season, we've been developing all of this. We're looking at state grants to cover 4 to 5 new staff members. However, we've identified just amongst ourselves at least 6.5 additional staff members that we would like to hire. That would make it ideal for us to do many different activities, including additional nurses, public health specialists, you name them. I mean, we need them. That estimated additional cost is over $500,000. So those additional people, what we'd like is for, that expanded focus. Right now, our focus is on the pandemic. That is, no joke, I'm pretty sure every single health department out there will tell you that it's all hands on deck right now. Everyone is doing something related to COVID right now, even if it's not their normal activities. But we also know that at some point this is going to come to an end, and we want that expanded focus, not only on what we were doing before, but personally, I would like to expand where we were before. We were, of course, doing healthy eating, active living. We had vaccination efforts where we were paired up with the school districts to do their vaccination events. We had started doing a little bit of mental health outreach and some work with comprehensive mental health. I would really like to expand that. In multiple different community health assessments in the past, we identified suicide as a major issue for our community. And of course, during the pandemic, that's only become more clear to be an issue. However, of course, all of this requires identifying additional resources. So what I'm here tonight is really to ask you guys, what scope of services should we be doing? What should our staffing look like? And, we had at one point been looking at accreditation. Should we be continuing to do that? What route should we do? Because there's a couple of different ones out there. We had previously been doing FAB, which is Public Health Accreditation Board. But I'm curious to hear what you guys have to say, where you guys think we should go. I know this is not a one and done scenario. I know this is a conversation that's going to have to be ongoing. So I will be quiet now and let you guys give some feedback.
In regards to the accreditation, I know that when the department came to an end, there was still some aspects of that accreditation process that were still pending at the time, so to speak. And what is still available? Can we pick up any of the effort or work, or do we have to start all over?
So some of it's going to have to be started all over. Some of the things, a lot of it's policies and showing that we perform certain functions and that we do them in a consistent way. Right now we're not performing many functions at all because, you're looking at the majority of the health department right now. So, I'm sure Shauna and some of the others have things to say. It won't be a complete starting from scratch, but we would have to reapply, which does cost money to apply. And then we would have to start going through the process, which is not an easy or a short process.
Yeah,
No,
I can add to that.
Go ahead.
Accreditation was a huge process. It took several of our staff members to get to where we were. And if I remember correctly, we tried multiple times and it took so much staff time and was very cost prohibitive that we didn't have the support of our director or directors at the time to continue with that because of the cost.
What
Yeah,
is the disadvantage of meeting without accreditation?
So accreditation is nice for several things. It does open you up to additional funding. There are certain funding sources that are only available to accredited public health departments. So, it's one of those things that it's going to cost money and it's going to cost time to get there. But we have multiple health departments throughout our area that are accredited. And I mean, Clay County, I personally think did a lovely job of getting accredited, and they do a lot of really good work. They follow their systems.
Oh, I would agree. And I don't think it's impossible to do it. I just think it's a lot of staff dedication. And I believe even Clay County had a person dedicated to coordinating the accreditation efforts.
Mr. Chairman, Jason White here.
Yes.
I think this is great conversation. I think this is going to take a while for us to come together on some recommendations, because I think this has got multiple variables. But I like the idea of what is the goal, and it seems like the accreditation documents will help us define how to look at a top-notch health department. I also think looking around and maybe interviewing some folks that are with well-respected health departments. I know Dr. Morris has a list of 10 essential elements for a public health agency. I think this is a moment that doesn't come around very often, and I don't know whether we crank out weekly meetings and drive Christina totally crazy with some requests for assistance. But I think we've to define what missions we want the health department to do, and then see how we get there. Will help. We're the gauge of the community on this, and so this is a neat opportunity to be asked to do this. But I guess how do we set out a process? Yeah, I can't believe I said that. But how do we set out a process to do that evaluation of water quality departments of communities of our size, and the accreditation, and move forward with that to bring something back to the city administration and the council? I'll go back on mute.
Well, one thing that I think is going to be probably an important consideration is the accreditation issue, because of the additional funding that gives us access to. I think in the long run, that's going to be an important part of getting our program up and running, and not just up and running, but the most capable that we can get it to become. And when we look at the idea of anything less than accreditation, then you're going to be limited in what you can apply for. And I think that's something that I would probably suggest be a part of the initial planning, is what will we need to do in terms of establishing some priority for staff time to develop and maintain the progress on accreditation.
This is Terry Morris, just my 2 cents on thought of accreditation. And I don't know how health department, I'm familiar with accreditation in my little part of the world, like John is and everybody else is. And accreditation in the medical field gives you access to information that you don't have to go hunting for. It's given to you. This is what's happened this week, and things change so astronomically fast now. It's hard to keep up, and for me, accreditation made a difference in getting that information in a timely fashion, and catching it 6 months down the road when everybody else is already taking care of that. And I think it's important, if you're going to have a health department, to have one that functions at the highest standards you can. The population deserves it.
I'm a little bit out of my depth here, but if the pandemic has taught us anything, it's we underfunded health departments, we got rid of health departments, and then when we needed health departments, we didn't have them. So my 2 cents is just that we need to have a robust plan and strike while the iron's hot, because we have this opportunity now. what essential functions do we want. Accreditation is part of that process, and develop a plan that looks like that. So for what it's worth, from as much as I know about health departments, but from an essential need, from a community need standpoint, it's been demonstrated we need them. They serve an essential function for the community.
Christina, are you looking at FAB again?
It's the one I know. So, I mean, it's the one I'm most familiar with, but if someone has a different opinion, you know, I am open to it. But I mean, as you said before, I mean, when I worked on that before, it was literally a full-time job, and we still didn't make as much progress as it would be nice to have if we had, you know, additional staff that could assist.
No, and we still, you know, to be honest, we still ran a robust health department without it. That said, we do have an opportunity, and I agree with everybody's opinions on that, to develop something within those guidelines. But I mean, we're a long ways away for applying for accreditation.
So I would propose that, as far as our efforts to make determinations, I would think that if we could estimate what our what is needed to establish the accreditation and how long that might take, and you know, the staffing that would be required to accomplish it in the time frame that you would think that it's possible to accomplish it. You know, that would be one of the areas that I would suggest be included in the planning process.
And I should warn you guys, it's not a short process. I believe when I looked last that it was estimated to be a 2 to 5 year process in order to get accredited, depending on how quick, you know, a department can put it together. And I mean, Shauna's right. We're not coming in hot on this, so it would take a little bit just to even get the basic paperwork together and show the basic staffing in order to start.
Yeah, that's 2 to 5 years for an established health department.
So do you have a timeline that you're working from to get approval from the city council to getting staff on? Here's what the first 6 months looks like to the next year, so that it's helpful understanding how the build out works.
So yeah, so what we're looking at right now, we have approval. Well, we have added the different positions back into the table of organization, or onto the pay plan, so that we can hire them. We get approval to hire when we can show that we have money to hire people. For this next year, what we're looking at doing is having a public health director, adding in an admin, an assistant director, an epidemiologist, which is what we're actually interviewing for this week. We complete interviews tomorrow. A public health planner, a public health nurse, and a public health specialist. So kind of the basics we're trying to get under our wing right now to have for this coming year. But in all honesty, I'm not kidding. That is totally dependent on making sure that state funding comes through, and having just like the little bit of wiggle room in the rest of the budget to pull those people in. And then in about a year, we'll have to have identified other funding sources in order to hire anyone additional. I mean, we would love to hire on, you know, we would obviously love to hire on additional nurses. We would love to hire on additional public health specialists. One of the things that, and I'm not just sucking up to somebody who's on the call, is that we used to do immunization audits at our childcare facilities. I know vaccinations is a big thing that you guys all care about. We cared about it too. Doing it with one nurse is going to be really, really hard to do. So, you know, it would help us to have additional staff if we want to focus on mental health, if we want to focus on, other things outside of the pandemic. We need the staff. But we're very interested to know what you guys think we should be hiring staff to do. What should their focus be as we come out of this?
See, and I'd like that to be part of our conversation is what are the functions and how do we prioritize those? Because I know enough to be dangerous, but I gather there are some things that the public health department has to do. I mean, so, but there are other things that are good for this community, but not necessary for that community. And so how do we sit down and look at our community? Yeah, I would advocate for child vaccinations because we don't live in Olathe. We got a lot of families that struggle financially, and so helping them make sure their kids are protected to me seems to be a high priority. But maybe evaluating the restaurants is a high priority, or other endeavors. And it just seems like one of the early steps we need to take is prioritizing function. And I would need to be educated to some degree on what are the classic functions. I mean, you mentioned an epidemiologist. Well, I guess how many of those do you need in a community of our size to track STD outbreaks? And if I called that wrong, I apologize. Didn't mean to be rude to anybody. But how do we figure out what the priorities are by function, and then look for staffing to support those priorities and let this thing evolve? Because I don't think we're going to be able to get from the community the size department you were asking, in one fell swoop. Thank you.
Well, and to that end, I mean, whatever the group decides, we can move forward on the discussion. I mean, I am more than willing to share, and I know Dr. Morris knows them. There's the 10 essential services. There's the core functions of a public health department. All of these things are set out, and they're kind of the Bible of public health, but how we go about doing them is different for every single jurisdiction. We can also go ahead. I know Jackson County has continued doing community health assessments, and after our health department transitioned, they folded us in. So, I mean, we do have some older data, and we have some of their data to look at on maybe what the priorities are, what the needs are for our community that I could share. I know you guys are great researchers, and you could probably come up with 12 million other ways to determine what we need. You guys tell me what you want me to find, and I'll find it.
Do we still have access to any of the previous protocols when we were actually establishing, what are the priorities that different aspects of our community health were, they did a survey, I think, of the community and what the community was suggesting, and then did a composite presentation of that.
Yes, we still have access to that. That was kept on the server, and we made sure that it was never gotten rid of. So we have squirreled that away, and I'm one of the people who have access still to all that data. So we still have it hidden away.
So we do have some respectable data as far as just not that old, but not up to date necessarily.
Right, you should have a community health assessment from 3 years ago.
Yes, and we also held, I can't remember what we called that meeting where we actually went through the priorities. The chip, yeah. Yeah, we have a lot of useful things.
This is Peter Millen. I have a question. You mentioned there's like a list of like 10 core things that need to be done by the health department.
Yes, 10 essential services.
Do you happen to have that list there? Can you rattle them off, or is that something you can send us?
I haven't been asked to rattle that off since I was in.
Since you got
Shauna,
hired.
can you do it?
Oh, don't put me on the spot. I'm driving.
But I mean, that kind of looks like the 10 Commandments. I think we ought to, if that's the meat and potatoes of the business, I think that's what we should start.
So
And
thanks to Google, I can do that for you right now.
What?
Yeah, and they're very broad statements. They're not necessarily specific activities.
Yeah. So the 3 core public health functions are assessment, policy development, and assurance. And then the 10 essential services are to monitor the health status, to identify and solve community health problems, diagnose and investigate health problems and health hazards, inform, educate, and empower, mobilize community partnerships, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health, link people to needed personal health services, assure a competent public and personal health care workforce, evaluate effectiveness of accessibility and the quality of personal and population-based health services, and research for new insights and innovative solutions to health problems. So those are all 10, and my professor would be so disappointed in me for not having them still memorized. So.
Okay, so when you said that you were going to hire this base of 5 or 6 people, were you looking at certain points in this list of 10 things that you were prioritizing?
Well, they should be able to do some of the very basic functions for all of these things. We already have food inspectors, which are coming back under the wing of the health department. So they're enforcing the laws and regulations. Administration develops policies and plans. Our nurses will help, with that personal and population-based health services. And they and the public health specialists are really good at informing and educating people. So, and then the EPI and the planners are all about that monitoring and responding. So, all of them cover those 10 essential services. It's how you want to interpret those 10 essential services. And I guess it is kind of partially quality, because the honest answer is 5 people serving, or including our public health investigators, our food inspectors, 8 or 9 people serving the population of about 120,000. You can't be everywhere at the same time. So there'll be some things we just won't have time to do.
Well, until we get the full staff, I agree. So like Dr. Morris was saying, we'll probably have to prioritize.
So a good place to start with the prioritization process would be those 10 items. Just kind of put them in an order that would give us a kind of a baseline of to work with.
How many people were in the department when it was closed?
There were about 23.
Wow.
In the heyday, there were about 50 people. That was a while ago. In probably about a decade ago, there were about 30. But they included property maintenance officers who got moved over to our community development department. And then so at the end, we were just right there in the 20s.
And some of our staff fluctuated based on grants and the grant time period.
Yes.
So what was your core of the base health stuff?
I'm sorry, could you repeat that?
What was the number of your base? You're talking about some of this other peripheral things. Is there like a core number of, was it 15 of the people that were doing mostly health related stuff?
Well, I would like to say all of them were doing health related stuff. We had,
When you had 50, you had property people.
we did. And
So
we had
I'm
50 a
saying,
long time ago.
When you eliminate those kind of people, what's the core number?
We had about probably 4 or 5 at any one time that were focused on healthy eating, active living sorts of things. We probably had another 4 or 5 who were focused on communicable disease. We had at one point an accreditation coordinator who was focused on accreditation only, and worked with all the different divisions. We had our environmental health people, which included animal control and our food inspectors. There's 3.3 food inspectors plus their admins. I mean, once you factor in the admins and the administration, I mean,
We had emergency preparedness, some planning,
yep.
but health educators.
And they did a lot of things, everything from community gardens to Hungry and Homeless Coalition, disease monitoring, inspections. We had people who went out to teach kids how to properly wash their hands. There were a lot of activities.
Did you have included a grant specialist, or was that somebody that's a part of the community staff in general, or did you have somebody specifically for the health department?
So at one time, we most definitely had a grant coordinator because I was the grant coordinator. However, I was the grant coordinator because specifically there was a large grant which needed to be cared for and watched and taken care of. So, we had people who were specifically paid out of grants that were not state grants. They were all essentially, if you were paid out of a grant that way, you knew you were also a grant writer, and that was part of your job, was to write the next grant to pay yourself. So we had people who specialized in that if you wanted to keep your job.
We were all grant coordinators and grant writers and grant managers.
Well, we're starting over, and I agree with some of the comments here. What are the baseline? I think Dr. Muehlman had asked of, and so teaching kids how to wash their hands is great, but I'd say not tomorrow. And healthy eating, I get it. My wife teaches me that on a regular basis, and I'm not going to tell you I'm a very good student of that. But to me, I mean, how we settle on what are the hardcore things to get started with is where we need to be focused. So epidemiology and the vaccinations and the food issues, those hardcore functions. Part of the issue here is we're in an economic situation. Independence is not particularly wealthy financially. But I think our first goal is what are the critical functions that we need to identify for the council and the community. And I think we've got to stay focused on the high priority ones. And how do we identify those, and then identify in a community of our size, how many people does it take to handle the epidemiological needs of disease outbreaks here? I mean, I get it, but I don't get it that there's a regular stream of diseases that they need to be tracking and paying attention to. But how much of that goes on? And so does that warrant a half-time or a full-time or whatever? So I guess to me, how do we identify core functions and then work from there? I think we're also looking at a multi-meeting little project here. So I don't know what process we should have, whether we're going to start meeting, with this as a tight focus, and we all try to help Christina with some homework. I mean, I'm happy to jump in and start looking on the internet, and if people feed me things to read, because I'm not as practiced as anybody else on the Board of Health in this field, but happy to, if Clay County is an exemplary one, I'd love to talk to Gary, what's his name, and say, hey, you know, if you only had 3 people, what would you have them do? If you had 10, what would you have them do? What are you, and you know, pick the brains of the smart people so we can come up with a plan. Sounds like the city needs some consultants, and we drew the short straw.
No, I disagree. I mean, we've got 2 of us on this call that came from this health department. So, I mean, I did communicable disease for the City of Independence, and I can tell you how many people it takes. I can tell you what services we provided and where we were 3 years ago and where we were 20 years ago. So I can help do that. So can Christina.
Hey, Christina.
Well, I think that if we were to prioritize and say that we were going to have to go forward on with your start day 6 months from now, and you've only got a quarter of the staff that you need, I would imagine you would start with infectious diseases and the environmental things.
Yeah, you have to have communication.
Hey, Christina.
Go ahead.
Yes.
Hey, it's Darrell Nelson. I was listening and pondering, and you know, in the hospital business, we talk all the time about the emergency room is the most expensive primary care clinic in the whole healthcare delivery system. And I just wondered, since we're going to have to prioritize, would it be of any benefit to the board if I tried to get some very recent data on what the scope of services is that we're delivering in our emergency department, and see if we can break that out kind of based on acuity level, and see if that would help inform us. I mean, it wouldn't be any surprise to probably anybody that behavioral health is going to top the list. We've seen a notable increase in all facets of behavioral health, in depression, in uncontrolled schizophrenia, in suicide. Trauma is probably a close second, and there are strategies that are implementable there. Certainly infectious diseases there. And then you get into a lot of the impact of the chronic disease management, the heart attack, the stroke. We just looked at some data a month or 2 ago. We have more incidental nodules found in lung scans in CenterPoint than we do in all of our other HCA hospitals in Kansas City. So there's no question that there's an opportunity with tobacco. So I think there might be some data that talks at least about locally what's really driving folks to have to seek either emergent or non-emergent care because of lack of access to health care, that might be able to inform us if the board thinks that would be of some benefit. Because I'm sitting here thinking, wow, it's such an opportunity, but it seems so significant, right? I mean, it's just so big. How do we try to scope it to where we can get, the greatest impact with the resources that we have? And then just on accreditation, I would just echo, I know it's a lot of work, but having served as many of you on a lot of community boards, I think it's one of those we're going to have to figure out a way to invest the money to get a flow of money. Probably, I just would imagine, with as tight as things are going to be post-COVID, that we'll find ourselves really challenged funding-wise without some accreditation. I'm not familiar enough with the options in public health to have a particular opinion or recommendation, but I would think trying to get down the path of something accreditation-wise would be of benefit to us.
One thought that I would add to what you just said, Dr. Nelson, is the idea that what brought us to this point as far as reestablishing the health department, and that is the pandemic. And I would tend to think that one of the priorities would be to make sure that as we're establishing our health department, that we would be preparing for the next event, and before we actually start expanding into too many areas, so that we would actually have the ability to face the next event with a much better preparation, and the ability to accomplish what we are doing now much quicker and a lot sooner with, because we've already experienced it. We don't have to reinvent the wheel.
And Dr. Ruckman, that's a really good point. And some of the grants Christina mentioned, like FEP and CRI, that's what those grants are for. So while we would get to choose kind of some of the things that are our community priorities, some of the grants also dictate, you know, what we will do. So we have to keep those things in mind too once those state grants become available.
Are there any groups, I don't even know the right word, but associations that can be accessed to help us develop a plan? You people are busy already. Are there folks that are available to serve us, can serve in helping develop a community health department? I know we have some building blocks already, but we're kind of starting over too. But is there professional help out there that you can access through grants or through Mark or anybody that would help us in this way?
Well, I mean, I know Mark has already been helpful, and they're willing to help however we need. There's other groups throughout the state, Mo Alpha, MPHA, MoCeFi. They're all different groups of public health departments who get together and share essentially what's going on, what they're doing, what they're seeing. I mean, I know a lot of them are focused on the pandemic right now and stretched thin.
I just look at some assistance in this development, not so much you know, from the ground up, but technical assistance in developing a plan that helps you identify those essential functions so that we can get some action moving.
So I'm not sure I can necessarily tell you of one. Shauna, do you know of any?
The first essential function of our health department has to be communicable disease. I mean, COVID or not, communicable diseases are still happening and outbreak risk is still there. And at some point, Jackson County is going to stop doing that for us. So there are certain diseases that are reportable by law that have to be reported to the local health department. And now that's Independence. So Independence needs to be taking those, reporting them to the state, doing investigations. I mean, those things have to be happening.
Yeah, and that's kind of like ASAP, I would presume.
That is why we are interviewing that epi this week, trying to get them in as fast as we can.
And so do you have the next position that you're looking at filling as far as what you're anticipating? Is it a week or two or a month afterwards? What's the status of the next position?
I know how to do this, sorry. So we have others posted and we need to line up the next round of interviews. We have a public health nurse who's part-time, who we are in the process of hiring. I want to get that. We still have to do interviews for a planner and a specialist. I mean, unfortunately in this, the best possible way, other departments are totally helping. They are carrying a lot of the load because, as we've mentioned, COVID's going on. So I'm trying to pull myself between vaccine clinics and testing clinics right now. And I only have so much time in the day. So they are being kind enough to try to work around my schedule to allow me to at least sit in on some of these interviews. But, they're conducting some of them without me, which makes total sense because they need to get it done. So we are moving and we hope to be able to have most of these people hired in the next month. But I mean, a lot of it's going to also depend on, you know, who we choose and when they're able to start. I know we have some people that we would like to start, but you know, it may be 3 to 5 weeks before they can actually get here. So
where do you plan on putting all these people and establishing the health department residence again?
excellent question. So that is something that right now it looks like we're going to be in the bottom floor of City Hall, first floor near Municipal Court. There's a section that used to be where Animal Services was before they got moved out to the shelter, and where our city clerk was. So we are going to be taking over some of that space. We are in the process of, you know, it's being used for some storage. So we need to get those items relocated, get desks moved in there. We already have a lot of it done, thanks to a lot of help from volunteers and other departments. But we need to keep doing that and we'll get them moved in. So hopefully by the time we're actually getting people hired to start, we'll have space for them, which would be nice.
So Jason here, could I suggest maybe we elect Shauna to chair a work group that would drag a few of us along to start trying to rough out what are the priorities, next steps, some sort of timeline? Because, you know, we can't rebuild it overnight. We know accreditation is a long-term goal. We know there are priorities amongst the variety of functions. We know the city's not going to be able to hire back everybody in one swoop. So how do we advise them in a thoughtful manner? And I don't know that an hour a month is going to get us any kind of thoughtful outline or framework to bring to them. And it sounds like Dr. Nelson's got some interesting data, and there's other available resources. It sounds like, you know, some of us are going to have to burn a little midnight oil. And I'm glad to volunteer Shauna, because if I remember right, she's an MPH and a professor in this stuff now, and so seems like she'd be the one at the point of the spear. I'll shut up.
You said your piece, huh? Yes, I'm happy to help with that.
I'm happy to volunteer to assist. I think it ought to be open, transparent, but it does seem like we're going to have to pull together the issues, and it's just going to take some boot, you know, shoe leather here.
Is there anything specifically that you want from this group to get started with this task of rebuilding the department today, tonight? A direction, note of
I don't need
approval?
anything. I don't need anything tonight, except having, I guess, a plan going forward. So if the plan is to form a subcommittee for us to meet and discuss, that is what we need tonight. We need a way forward, how we're going to do this. We don't necessarily need the answers tonight. I would not expect anyone to be able to spit out all of the answers about exactly who I need to hire. So what we need is someone to be able to take time, or a group to be able to take time, look at what our needs are for as a community, and then be able to tell us, you need 2 public health specialists, 5 nurses, and an extra epi, or something to that extent. That's what I'm looking for. Someone to tell me what our community wants to see, what they need, what functions specifically outside the essential services need to be done. Are we looking at more healthy eating, active living? Or are we looking at freedom from smoking? Are we looking at community gardens? What are we looking at?
I think we still have to keep in mind that it's an evolving process. I mean, we can come up with your minimum item, maybe the top 5 things this work group could come up with of what you need to get started, or what programs you should focus on. But, you know, as you know, from public health, things change and grant opportunities come about, and there's just different reasons that things change and different programs are offered in a health department. But that's definitely a starting place.
A thought that I might put out on the table would be that since we have 10 items that are the priority that, you know, you might want to remember, we might want to all memorize, so to speak, to make your professor proud of you again. But the idea is that we might take the top 3 and make a focus of those things, because obviously those are the most important things. And, you know, anything that doesn't fall in the top 3 or 4, you know, we should just put those things, unless there's something that comes along and becomes a priority. I would say that that'd be a good place to start. And with those 3 items primarily, you know, and the pandemic to follow up on, I think we'll have a full plate. You know, if we do have a committee that works on the reestablishing of the Board of Health, then I also think we could establish with, you know, the rest of the Board of Health members, a voluntary group that would come together to help keep focus on the pandemic issues that need to be followed up on as well. Just a thought.
So do you need a motion to submit to establish a subcommittee?
I would think that would be in order, yes.
I move that we create a subcommittee to study the needs and the structure of the new Health Department of Independence.
Okay, do we have a second?
Second.
Jason.
Okay, any discussion on the pending motion?
I'd just like to make one point, what Dr. Nelson pointed out. I think having him input what goes on in the emergency room would be really helpful, both to this subcommittee we're talking about and to the council in general. In all my years, about 90% of what I saw in the emergency room was due to behavioral health. You know, when somebody punches their fist through the window, the plastic surgeon comes in to fix a tendon, but it's really a mental health issue that prompted that injury. And so I think having the council and the subcommittee know what it is that's going on in that acute care facility would be helpful in helping us determine what can we do to make an impact at a city level. I think that may be helpful. So
I agree, Dr. Morris, and that's the kind of data, you know, down the road that the health department would also use for future grants.
Any other thoughts? Okay, if we don't have any more discussion, let's, you want to take a roll call on the vote?
I can do that. Dr. Ruckman,
Yes.
Dr. Morris,
yes.
Dr. Ruddy,
Aye.
Lori Halsey,
Aye.
Shauna Jackson,
Yes.
Dr. Nelson,
Yes.
Jason White,
Yes.
Dr. Muehlman,
Yes.
and then Dr. Wingert or Dr. Potts. I don't believe they're present. Okay, the ayes have it.
Okay.
Dr. Ruckman,
Yes.
who's on this work group besides me?
Well, I don't think you're going to be alone. We'll make sure we give you some good helpers.
As I was voting for it, I thought, wait.
I'm happy to help, Shauna.
Thank you, Lori.
Okay, so at this point, we have some people volunteering. I think that, you know, in terms of the size of the group, any suggestions that we might want to look towards, how many people we would want to have on this committee?
I'd let anybody on that wants to be on. I'm sorry, sir.
Okay, at this point, who would like to volunteer? And if you're ready to, you can volunteer now so that we can see who is eager. And then, you can still volunteer afterwards if there's not enough that join up. So
I'm happy to help.
Okay, Dr. Morris.
I'll be glad to help, Peter Mielman.
Lori Halsey is well.
Jason's happy to help.
Well, it sounds like we've got a good committee already getting started, so we'll let you guys decide when you want to get together and who you're gonna put as your committee chairman, and we'll go from there.
Do you do you want a strong recommendation for the board, from the board, on priorities with the minimal amount of staff you have? Or do you want to just, something that you can use until your committee's together and comes to a decision?
I am more than happy to take any recommendation you guys are willing to give us. I know that the people that I currently am looking at hiring, though, I think I should say, are ones that the state has told me I need to hire with their money, which is a pretty good push for me to hire those people.
Yeah. I would, if you want a strong recommendation, I'm willing to put a couple, 3 things out there as a priority if you want that. And I'm sure other people in the group might want to contribute to that list too. And then maybe we could come with a priority list of, we think, mental health issues are higher priority than, food inspection, or whatever we come up with, just to give you some guidance until you get the ball rolling. Because eventually your director's going to make all these decisions, probably.
Well, not to sound like I'm trying to cater to you guys, but you are the advisory board of health. We are coming to you tonight because we want you to advise us on the way forward. You guys tell us what is best, what our priorities should be. You represent the citizens of Independence, what our needs are. You guys know these things. You're also experts, of course, in your fields. Please tell us what we should focus on. So if the committee is able to come forward with that, it would be most helpful.
Well, I think that's a good point, Pete. And so I think that'll be a good place to start.
Well, I think the COVID/infectious disease has got to be at the top. Is that that's my suggestion. Is there some discussion for that?
I would endorse that. That's part of what I was expressing earlier.
And then I think the second most important thing that we should be doing is food inspection until we get this group going.
Well,
Are there any
Christina,
other priorities?
we still have staff that's doing food inspection, animal control. They just got control got rolled to the police department, and so those functions are being carried out.
Yes, those functions are being carried out. They were rolled to other departments. Their animal services was then rolled into a totally separate department when the shelter started back up. We are in the process of rolling them all back in the new and improved health department. So
what services will be coming back to you pretty immediate that you need staffing? I heard you say Jackson County with some tracking with COVID and some other, are there other functions that are going to be rolling back to you that you need to get up and staffed and working on in the immediate?
Everything, Shauna was right. She mentioned that Jackson County would be rolling back those duties to us. When they're being funded by the state. They received the allocation for the entire fiscal year to be doing epidemiology for Independence. So they are continuing that, which is case tracking, the contact tracing. All of those services are currently being done by Jackson County. When summer gets here and a new fiscal year rolls around with those grants, they will no longer be providing those services. So we absolutely need to get an epidemiologist on board, trained up and ready to go. The state is working on giving everyone access and getting Independence data separated out, because right now Independence is still rolled in with Jackson County data. They're working on the logistics of it to have it ready for us, but Jackson County absolutely will stop doing those functions for us. So if we would like to know how many cases we have, we will need to have someone to be doing that analysis.
How many full-time equivalents does that take?
That is a good question. Before we had one epidemiologist, and that person was supported by the rest of the communicable disease staff to assist with any contact tracing and case investigations. That was pre-pandemic. We probably need a lot more than that, but the honest answer is the state funding is not going to support more than that. State funding for FEP this year, I believe for our city, is estimated to be right around $90,000. When you factor in benefits and everything else for a salary, it's not supporting more than one individual.
So to do infectious disease properly in Independence, it's going to take how many people do you think? You've got one for sure that you have. Is it going to take that and 4 other people?
During the pandemic, easily. Because pre-pandemic, communicable disease, that division had 4 people. And they were busy, and they stayed busy.
So you don't have enough staff to even do the most basic thing, which is infectious disease right now, in a month or by summertime.
We will be extremely stretched thin, is the honest answer. It will still be all hands on deck. So our public health specialist and our public health nurse and everything from the director to the assistant director will be all hands on deck, assisting the epi and helping do any contact tracing, case investigation. We are incredibly fortunate that we have the Medical Reserve Corps of Kansas City located within our emergency preparedness group over at Fire right now. They have so many volunteers that have been fully trained and certified to be doing contact tracing and have been doing contact tracing for other jurisdictions. We're going to have to rely on volunteers. There's no way around that. I would like to be staffed to the point where we could do it on our own, but that would take dozens of people that we just cannot afford. Unless someone knows where there's a huge pot of cash or a private funder who would like to step forward. That would be lovely. Please give me their names.
Well, there's really no reason to give you any other priority than infectious disease if that's going to take all the resources you have at this time. Is that right?
True. Even our food inspectors, to some extent, they may aren't doing contact tracing, but they're out there enforcing our health orders and all of those policies. So they are doing their bit during this pandemic to enforce that side of it and try to keep people as safe as they can.
So there's no reason to add any more beyond infectious disease and food inspection, right?
Yeah, I don't think until the pandemic is over that we could handle anything else.
Well, there you are.
But I think we still need to prioritize as hopefully the pandemic winds down and we're able to find other funding sources. We need to kind of prioritize. When we can, we'll address this, and then we want to address that and kind of decide how we're going to phase back into this.
Okay. Any other thoughts or comments that anyone would like to make? Well, do you think there's any other discussion that we need to consider at this point, Christina? As far as, you know, related to the health department issues?
No, not at this time. We can move on to the last thing on our agenda, truly. Just COVID-19.
Okay. Well, Dr. Morris, do you have any information that you want to share with us and bring us up to date?
Yeah, I don't really have too much that's new and different. Let me find my little share screen thingy. There we go. The MACG did not meet this week because things have been looking good, so they postponed their meeting. If you look at these are the daily new cases for the region, which it actually had been following. However, it's, as Dr. Fauci said the other night, it's really kind of plateauing here. So we'd like to see it keep going to zero. We'll see what spring break does. If you break out just Jackson County Mo, we pretty much see the same sort of thing, except that we're dropped more significantly than the rest of the region. And so that's looking very reassuring. This is new hospitalizations, which I think is probably better than looking at case count. And at one point in time, we were admitting 300 patients a day, and that's going down significantly. And again, particularly if you break out Jackson County. Last Sunday, we put in 6 new patients, so we're averaging about 13 a day, and that's astronomically lower, and the hospital stay is shortening. But as you can see here at the end of this graph, it's kind of plateauing out also after the last couple weeks. Death rates are hard to figure out what to do with because of the delay, but the death rate seems to be dropping or plateauing. I think probably the most interesting slide that came from the state of Missouri is just looking at our immunizations. And the really nice part of this is this bottom part of the slide where it shows that in the 65 to 74-year-old range, we've immunized at least one shot in 55% of the population, almost 57% of the population over 85. I don't know what the 75 to 84-year-olds are doing, but they drop a little bit behind. The interesting part of this data is that the highest incidence of COVID positivity is in the 17 to 25 range down here. So it's interesting that that's who's carrying the disease. But overall, it's reassuring, and hopefully spring break won't screw us up too bad, and people won't. We're seeing a lot of this, oh, well, it's all over phase, although we're actually at the rate that we were last July as far as disease incidents and hospitalizations. death rate's a little bit lower because the hospitals have gotten so much better at treating this disease than what they were at the beginning of the outbreak. But overall, it's reassuring, and let's hope it keeps going that way.
Very good. Thank you. Okay. Any other new business or thoughts that anybody wants to share before we bring this meeting to a close? Hearing none, I will declare this meeting adjourned.
Thank you.
Hey, John. Oh, did you have something you wanted to say?
No, good night.
Oh, okay.
I want to say good night.
Good night.
Thanks, everybody. Have a great evening. Be safe.
You too. Thank you.